Hi everyone, my name is Halima. I'm a dentist at Forest Dental, and today I'm joined by Abby, one of our dental nurses. We'll be talking you through all the do's and don'ts, what to do before an extraction appointment, and any instructions we give you after. So Abby, what do we usually say to our patients before an extraction appointment?
So before an extraction, we'd say for you to have a tidy meal before you come in, because we don't want your blood sugars to drop.
Yeah.
That's right. Yeah, that's what you say, isn't it? I always try to think now what you tell the patients when they come in.
This is like a little pop quiz for you, isn't it?
Yeah,
you got this.
Yeah. Make sure you take all your medication, obviously unless Halima tells you otherwise, and just to pretty much relax.
Yeah.
Like, try not to be so anxious. I know it's easier said than done, but you know, the last thing we want to do is cause you pain. And if you're relaxed, then it makes it a nice experience for yourselves as well.
In terms of eating a good meal before you come in, unless you're having sedation, then obviously follow the instructions for your sedationist. In terms of your medication, take all your medication as normal. If you are on blood thinners, I will usually advise you about what to do before, if I want you to interrupt it, if we have to speak to your cardiologist or anything like that. So we've done the extraction, everything's gone well, nobody's screaming, everyone's relaxed.
Nobody's crying.
Yeah, you or me or the patient, I don't know. So usually after we take the teeth, pop a bit of gauze in your mouth, ask you to bite down, firm pressure, and the reason for that is just to stop any bleeding. During that part, we'll give you a couple of bits of post-op instructions. So number one, we always say to you, even though it's very tempting, try to avoid spitting out. The more you spit out, the more you'll encourage the bleeding, and we don't want that, which Abby usually hands over to you guys. Has a bit of gauze in there, so if after you get home you notice some bleeding, what you can do is take this gauze out of the packet, dampen it, squeeze the water out, and firm pressure again for half an hour. That usually does the trick. If you can't get the bleeding to stop, either you can call us during working hours, or if it's a real emergency, call NHS 111. What do we say about smoking now?
Don't smoke for at least 2 days if you can, otherwise it will cause you even worse pain than the toothache itself.
So you get something called dry socket, and a lot of our patients say to us they regret smoking. What happens is the blood clot doesn't stay in the socket, and then the gums can't heal over tidy, and the bone is slightly exposed, and that's why patients report a really horrible pain. Even if that does happen though, you can come in to see us and we'll get you sorted.
Also softer foods.
Softer and warm-ish food, not too hot, because you're going to be numb, aren't you?
So things can't get stuck in like the little hole, obviously, where the tooth has just been removed from, and we don't want nothing to get stuck in there. You want to keep it nice and clean.
So we'll ask you to do hot salty mouthwashes the day after, not on the day of. So mug of warm water, as warm as you can bear, 1 teaspoon of salt, give that a good stir, and then rinse your mouth out with that. We still want you to brush the rest of your teeth as normal, just be really gentle around the extraction site. We tell you to avoid exercise if you can, or anything strenuous, because that can get your blood pumping and then you'll start bleeding in that area. Just have a really nice restful day, I think. It is quite anxiety inducing in our opinion to have these teeth out, and you just feel absolutely exhausted afterwards. So go home, put your feet up, put the telly on.
Yeah, it's all the adrenaline, isn't it? Like all the worry and everything. But
really important, you will be numb for a few hours. Please do not chew on your lip or burn yourself. Be extra cautious, because once the numbness wears off, if you have bitten your lip, you will feel that afterwards. If you usually have any questions, you can either give us a call, WhatsApp us. We're really on hand, so we can
try and make it a nice experience, not nice, but you know, a positive experience for the patient as well, don't we? That's the last thing we want, for them to be anxious and coming in. But
if you think anything is wrong, doesn't feel right, give us a call, come in for a review, and then we'll go from there. If we do pop stitches and things like that in, we would tell you, and we'll arrange a follow-up appointment if needed. But yeah, that's all the do's and don'ts.
We're always here, whether you need us or not. You know, we're always on the end of the phone.
Cool, thanks Abby.